We will now move on to our next panel discussion, Building a Quality-First Mentoring Ecosystem. This panel examines how quality can be embedded at the center of India's youth mentoring ecosystem, drawing from experiences globally and across fields of the social sectors in India. I call upon stage our moderator for this discussion, Dr. Vijayatri Bose. Vijayatri has over a decade of experience in applied microeconomics, specializing in evaluating health and social policies across global contexts. One of her research focus areas is the causal impacts of large-scale legislative and policy changes on the well-being of women and children. She has held research positions at the World Policy Analysis Center at UCLA and the Indian Health Systems Project at the Harvard Chan School of Public Health, and has also mentored with Mentor Together. A warm welcome to you, Vijay. I would now like to welcome Meera Venkatesan to join the panel. Meera is a learning and development leader dedicated to empowering young people through mentoring and career readiness initiatives. As Director of Program Development at Mentor Together, she leads our curriculum, program excellence, and monitoring, evaluation, and learning teams. Her work is grounded in data-driven insights and a deep understanding of both the education and social sectors, enabling impactful, scalable, quality mentoring solutions. A warm welcome to you, Meera. I'm now delighted to welcome Dr. Gunjan Taneja. Dr. Gunjan is a medical doctor with postgraduate training in community medicine and over 15 years of experience working at district, state, and national levels in India. He currently serves as Senior Program Officer for Health System Strengthening, Uttar Pradesh at the Gates Foundation India Country Office, and previously coordinated immunization coverage and equity efforts focusing on zero-dose children, urban immunization, and COVID vaccine rollout. He is also the first recipient of the Indian Association of Preventive and Social Medicine's Young Leaders Oration Award and a recipient of the same association's Presidential Appreciation Award. A warm welcome to you. Let us next welcome Vijay Iyer. Vijay Iyer is the Unit Director of Aspire and Associate Director of Policy at JPAL South Asia, where she leads efforts to translate evidence into action through large-scale partnerships with governments, civil society, and funders. She has held leadership roles at the Azim Premji Foundation, Quest Alliance, and served as the Global M&E Head at STIR Education. Through the Aspire portfolio she leads, Vijay has driven the scaling of proven solutions in education, gender equity, livelihoods, and climate action, enabling systemic, evidence-driven change across India. A warm welcome to you, Vijay. I would like to hand it over to Vijayatri.
Be patient for a little while before we break for lunch. But then Ian did such a great job at that I'm going to just jump right into the panel. Right? Okay. Thank you so much. Welcome to everyone. Yeah. Okay. Oh, sorry, my joke fell through. That means, yeah. Never mind. Okay. Let's jump right into it. So I think the previous sessions did a wonderful job at sort of setting the stage for our discussion. You know, we heard from anecdotal stories, from a research point of view, policy point of view, of the importance of mentoring, right? In the first session, Aditi talked about human skills. Parinita, she talked about the skill gap in terms of soft skills. right? So, and all of that, the one solution we sort of understand now is youth mentoring, right? And we are seeing in India a growing recognition that youth mentoring is a very strategic tool to meet sort of India's education, employability and well-being goals. There is an increasing acceptance. You know, you look at national policies, you look at emerging state and national youth mentoring programs, you see a sort of acceptance for youth mentoring as a tool for youth development, which includes helping them transition from school to work, right? But as we are thinking of expanding mentoring, it is a good time to pause and learn from maybe experiences in other countries, right? International experiences. So for example, in the US in the 1990s and 2000s, early 2000s, there was rapid and unregulated expansion of these youth mentoring programs. And what that resulted in was a wide variation in the quality of the programs. And so ultimately, when you tried to look at the overall effect or impact of these programs, it was found that they didn't really have much overall impact for the youth that participated in these different quality ranked programs, right? So India is now at a similar sort of inflection point, and that provides us a huge opportunity to start thinking about embedding quality in the mentoring ecosystem of the country, right? And that brings us to this panel. And we sort of want to make a case, like while you're thinking about the national mentoring system, we want to sort of lay out a framework that puts quality as a foundational principle, not something you go after 5 years later and say, hey, this needs to be added on, right? Let's start thinking of it, let's prioritize it, and let's start thinking of it when we are laying out the foundation and the framework, right? So what we're going to do today is sort of take a step back. Before we can even lay the foundation, we have to come to an understanding of what quality means. What does it look like in reality? How do you achieve it? How do you sustain it? And how do you scale it up, right? What are the ingredients necessary? So today, I think the wonderful panelists here are going to help us sort of talk through some of these issues, bringing their experiences from the international as well as the national context, right? We're going to talk about how, from Vichi's experience, how evidence-based programs have been scaled up without compromising on fidelity and impact. We're going to draw on Gunjan's experience in the healthcare system that has, sort of continuously tried to improve quality, build capacity, and so that there's population level outcome changes, right? And we're going to also talk to Meera about her experiences in the youth mentoring domain. All right, shall we get started? All right. Okay, so Meera, I'd like to start with you. I want to sort of get us on the same page, everyone here, everyone there, on the same page in terms of our understanding of what quality in the mentoring sense means, right? So in the field of youth mentoring, what does designing for a quality program, quality mentoring program mean? And perhaps in terms of operating procedures, curriculum development, maybe mentor training and other aspects.
Sure. Thank you, Chetri. And I think today I feel that my answer has been made a lot easier because I heard a lot of questions addressed with respect to that in the last few sessions. Amazing perspectives for them. So I would say when you look at what brings quality, what does quality mean in the mentoring field, I'd like to start with a single question. What do you want to achieve through mentoring? Isn't it? So it's not a question more, it's a thought that I would say that anyone who wants to get into mentoring need to think about. Because over time, mentoring has always been seen as something very powerful, but sometimes a bit generic. Mentors have been given a great deal of power and have achieved great results, which is amazing. But when you're coming to a programmatic aspect of it, what is this power really sufficient? Is an intention really sufficient? what is this intention directed towards? So I would like to say that the first pillar to understand what does quality mean in the mentoring space is for a design aspect to know what are you mentoring for. For example, let's take youth mentoring itself. A school-based mentoring program may be looking at increasing school connectedness, peer relationship, and to a large extent, better academic performance. At the same time, a youth-based mentoring program, let's say for a foster care home, may have a slightly different set of outcomes. It may be looking at building trust. It may be looking at making the mentee independent post their journey in the foster care. Or it could be, as some of you have spoken about, it could be about work readiness. So there are a lot of reasons to mentor youth, but what is the reason? This is going to define the quality, because quality can be measured only when the outcome is specific. Now, close of that, I would like to say that the second aspect is the processes. So quality anywhere, I think, in any kind of a setup, whether it's for-profit or for-impact organization, can be achieved only if the processes make sense. And in mentoring, in a mentoring program, I would say, rather than just mentoring, there are many critical processes which can make or break the success of mentoring. Like, for example, how are the mentees coming into the system? What is the fitment of the mentees to the system? How are the mentors recruited? What is the screening that is done? Is there sufficient emphasis to ensure that the safety aspect is taken care of? Is there sufficient process that is done to ensure that the fitment of the mentees is taken care of? How is the matching done? How is the supervision done? So there are many, many processes in the mentoring domain. So when you want to define quality in the mentoring domain, it will become very important to ensure that each of these processes have clearly defined process and outcomes and outputs which help us to reach that goal that we initially defined. So now, with the design of the goal and also the processes, I would like to actually address Priyanka's question from the previous session on the training part. Well, mentoring is, again, as I said, a very powerful domain. We have a large number of volunteers, and so on one hand, there is a feeling that, after all, they're volunteers, how can we even tell them to do something or not do something? On the other hand, we have a huge, and nothing to be discounted, a huge sort of a wealth of professional experience that these volunteers bring in. And it can be quite easy for them to say, I've been there, I've done that, and I've mentored professionally. What is different? Now, the problem comes that there is, again, definitely, as we were all talking about today, there are very specific areas where training is definitely required. Because mentoring borrows from coaching, mentoring borrows from therapy field, it also borrows from the skilling field. So while skilling can be individual, a lot of concepts of coaching like goal setting, active listening, supportive accountability are very important in mentoring. At the same time, building relationships, creating empathy, dealing with empathy, having conversations with empathy. While these are all aspects that need training, and quality training with specific focus would become very important as the third pillar of a quality mentoring program. Close on its heels is, of course, the curriculum. Well, we all have great stories of great mentors who uplifted very easily, and they did it with their personal experience, with their personal stories, which is great. But when you're trying to have a program, individual brilliance is simply insufficient. So it becomes very important to have a structured curriculum that will support the mentors to reach the mentees in what they want to do. This is, for example, let's say you have a program on career readiness. What are some frameworks that they can use to help the mentees? What are some tools and techniques that help them to build networks? While intuitively this knowledge may be there in many of the mentors, or it may not be there. The truth is, we want more, we want this as result to reach all the mentees. So I would say that a very structured curriculum and a clear curriculum, research backed, based on evidence, is very important for a quality mentorship program. And all of this actually help in creating a quality relationship, which at the end of it is the basis of any mentoring program.
Thank you, Meera, for that. Very succinctly put in the form of 3 pillars that we need to focus on. But I'm going to draw on one thread. One of the very important threads that you started with is the mentors themselves, right? And it relates to a question that was asked in the previous session too, a little bit linked to that, is in the youth mentoring field, more often than not, the mentors are volunteers, right? There have been allusions to sort of a motivation, intrinsic motivation, the generosity. In economics, we call it the warm glow that people get from volunteering, right? So there's no really any incentive, any monetary, physical incentives that they get. It's just volunteering. And the conception then is that it is very difficult to ensure and maintain processes and quality, right? Now, there is an interesting parallel we can draw here with our Indian health system, where in addition to qualified healthcare workers, doctors, nurses, radiologists, we also have a large army of paraprofessionals, right? For example, as of 2004, there were about more than 10 lakh ASHA workers, if I'm not wrong, across the country. So, Gunjan, if I can ask you, from your experience, how do you ensure quality when you're working in a system that is largely driven on the ground by these paraprofessionals?
So, thank you for that question, Jayatri. And before I think dive into the question, I bring greetings from the Gates Foundation and would really like to thank the Mentor Together team and Arundhati for this opportunity. We've been to multiple forums, panels over the last many years, but I think this is truly special and something that I value a lot. And it's also, I think, a good stage for me to acknowledge the mentorship that I have received over the last many years from innumerable mentors, and starting, I think, with my parents, and that's why my question was linked to that in the morning. And it's also great to see the energy, exuberance, and the enthusiasm in the room. So coming to the question, I think I'll just take a step back, and in fact I would just be reiterating what we have heard multiple speakers say today, and I think also connecting the dots from where Meera left off, those 3 or 4 pillars. Now they say that the end result is as good as the process which is put in place, and quoting MS Dhoni from multiple post-match conferences and presentations and media conferences, one thing which he has repeatedly said is that what we need to work on is the process, and the end results, and the results will take care of themselves. Now in the health system, when you work with paraprofessionals, I think the process really becomes very, very important. So there are multiple initiatives, I think, and mentoring has been an integral ingredient of that process which has been put in place for multiple health interventions that have aimed to deliver quality at scale. So be it the nurse mentoring initiative in the state of Uttar Pradesh, which is a peer-to-peer learning mentorship model, or the Regional Resource Training Center initiative, where faculty from medical colleges, so 20 medical colleges in the state, they visit district hospitals across all the 75 districts in a structured way, again to the point Meera was mentioning, and mentor the doctors and now nurses at the district hospital, or something, an initiative which I have been a part of in the pre-COVID era, which looked at improving the quality of care around the time of birth, and that's where most of our mothers and newborns still die, which leverage from training, mentorship, and quality improvement efforts. So I think building on those levers, what really becomes important and why these initiatives succeeded with and coupled with it, the process-driven approach. So be it the stewardship from the state government of Uttar Pradesh, which is the major stakeholder, the engagement with the governance mechanisms that were put in place, the structured tools which were introduced both for the nurse mentoring program and the RRTC initiative, or for that matter in the care around birth approach, where mentorship was only introduced when both the mentor and the mentee cohort were trained on certain clinical interventions that were being targeted, using a curriculum which leveraged adult learning principles, and then which was complemented by facility level led collaboratives of care. To Arundhati's, sorry, again, I keep on mentioning you, but to Meera's point on objectivity, I think that is very, very important. We need to be very clear about why we are undertaking this initiative. In the healthcare ecosystem, it becomes slightly easier. We have laid down SOPs, we have a set of clinical interventions that need to be targeted, and mentorship can be sort of tailored to it. The other thing is, how do you measure the impact of what's happening? Against a point which I think Meera raised. So, are there indicators which are quantifiable, which can be measured? And going back to a point I think that was made in one of the earlier panels, do we have measurement matrices which help us understand the process of mentoring itself? Financing is a very, very important pillar. You need to have resources and budgets put in to run mentorship initiatives. And of course, in today's era, how does it leverage the digital sort of ecosystem? I'll close this, I think, my submission by reiterating that mentoring, as I have learned and my worldview has expanded over the last 2 or 3 hours, it's not an abstract idea. It's an objectively driven, structured process, but which should address both the components, the core competencies that are needed to perform a task, but also the enabling lever. So in the health system, how do you interact with patients in a difficult scenario? How do you work in a resource-constrained settings? What sort of communication skills that you might have? And this is dependent on the objective of the mentoring initiative. For example, as I said, in health it can be more specific to interventions that need to be improved, and you then build in the softer components around it. Whereas in youth mentorship, it's more about determination and self-transformation, which helps an individual unlock his or her potential in the long run, I think, by building on the competencies and capabilities that a person possesses.
Thank you, Gunjan. That was great. So essentially, sort of reiterating what Meera said in terms of the importance of understanding the reasons for why you're doing the sort of mentoring program, the processes, the curriculum, having a standardized curriculum, and then sort of knowing how to measure the outcomes, right? You also talked about technology and finance, and I hope we can come back to that. I know finance you get at a later session, but technology I would definitely love to see if we can squeeze that in. I'm thinking, Vijay, what about your experiences from the other domains? You've worked on multiple education, livelihood, gender equality. So, and given the kind of work that you do based on JPAL studies, how do programs build quality, and then what aspects of those qualities sort of drive impact?
Thanks for having me here, and it's a little difficult going after those two because I don't have any new points maybe, but I'll try and join it to what I already heard and we all heard. In terms of the design bit, I think I agree with Meera, which is there is a lot in terms of the purpose. From what we have seen at JPAL and the programs, what I think works really well is when you have a clear mechanism. So yes, there's a problem diagnosis, and what Gunjan mentioned just before me, which is also have a clear mechanism of how we want to solve it. So I'll give an example from teaching at the right level in education, which JPAL is supported to scale up in not just India but also in Africa, where it's just not about give extra instruction. It's about the problem is basically kids are not doing what they expect to do at their age grade level. So the problem diagnosis and having a clear mechanism then through the program to address that. So just having that sort of clarity makes it easier for a program to achieve quality. The second thing is, again, already been said, but I'm just going to sort of agree to that, which is structural clarity on what does it look like, what are the routines, what are the roles that people have to play. So I'll again use the same example of TAL, where the grouping of the children based on their abilities is a very key component of teaching at the right level. So that goes back to, and I'm not using mentoring examples because A, I'm not capable of it, but it's just the way that I'm also looking at it from research and work that JPAL has done. We can see that structural clarity, routines, and roles really help. The third thing I can speak about is the simplicity of it. So simple programs often outperform complex ones, even when the complex ones are stronger theoretically. Because as you start doing them, when people have to deliver them, it just becomes much harder to maintain fidelity, to maintain that sort of process. Again, going back to both mentioned process, the process becomes too complex, you're just losing the fidelity, and when you measure them, then you're not sure it's getting, is it because it's not being implemented the way it should be, or is it because it's implemented and the program doesn't have any effects? So the idea of a simplicity and keeping it down, again, goes back to the idea of, look at the design, does it address the issue, and then the clear mechanism. You called me from JPAL, so I have to mention monitoring and evaluation. So yes, there is the whole idea of measuring and keeping, are we on track? Is this really going the way it should be on the major key areas? One thing I'll add to that is, it's difficult when we are thinking about mentoring in so many different ways. Just the last panel was in a very corporate setting for adults. It's an adult learning, there is health, there is schools. NEP says mentoring for higher grades, middle and high school. So it looks very different at different age and grade levels. So then it's about the operational realities. A government school teacher versus a corporate manager are two different entities, environments. So just building the program, thinking about that, and the quality depends on those realities as well. So I would just, have those four things in mind.
Thank you, and I'm going to follow up on that if that's okay. So you talked about simplicity in the program designing itself. Now, when you're thinking of scaling up, right? You're going from program, you're trying to institutionalize it, transform it into a large scale sort of system. Simplicity becomes a little difficult, right? So how in that case, what are the core elements that need to be preserved or adapted so that sort of the evidence-based processes remain, fidelity is maintained?
Sure, I guess I'm just going down the, this is what I do for my everyday living, so this is probably an easier one for me. But at Aspire, what we call, basically, Aspire stands for Alliance for Scaling Policy Impact to Research and Evidence. So basically what it means in simple language is, we study the program or an intervention, a solution, and it works in a very bespoke population. But how do you now make this really work for millions and at population level scale? So that's exactly what we deliberate and wrestle with on a daily basis. So what it brings it down to is to think about, if this worked, what is a causal core that made it happen? So strip it down to the essentials, and that's where you need the experts who basically understand what it means to mentoring. These are the researchers that we have. These are the people who work in and out, the practitioners who are basically delivering this program day in, day out, to be able to tell us in the NGO parlance or the development parlance, it's called the theory of change. We know what actually makes the change and be able to sort of keep that core. So I would say the analogy in my head would be like an engine. This is the engine that runs the machine. The second part of that would be then the system that, so when we talk of scale, we are then talking not about this machine working in this specific, let's say the car or a vehicle, it's about getting on the road, all of us knowing, which is, let's say 20 organizations then doing not just Mentor Together, running its own youth program, youth mentoring program or mentoring program, but 20 other organizations across 28 plus states or more countries, then that becomes knowing the rules of the road. So basically, how does this engine then, what do you do when this engine is running across vehicles, And how are we sticking with the lane? We know how this goes. So it's in terms of understanding what I think Meera mentioned earlier, having those basic idea of what will stick, what will work, and just sort of being in the lane, just understanding the ecosystem. The third piece would be monitoring and evaluation, in the sense that, you know, we talk about implementing programs and understanding the causal core and how this works, but a lot of times capacities in, let's say, organizations or even governments at some point in time, if you want to take it to scale, we want to finally become, you know, dispensable. If the government is going to take it on, another organization is to do, it is going to evolve over a period of time. So can they also have the know-all of how this, to monitor it and evolve it within the system. So make that not just about an implementation toolkit or a playbook, but think about it as common minimum monitoring and evaluation that's required for it to evolve within the system. So learn and improve. Think of it as the map that is there in the journey, which would basically tell us if you're going the right direction, if you need to course correct, sticking with the analogy of the road and the engine and the car. And the last one, and I'll stop very soon, which is the, give me a second. Yeah, I mean, the whole idea of being able to, sorry, I think I have to look at my notes.
Last month.
Sorry?
You can start from last month.
Oh, the institutionalization, which is basically the playbooks and the things. When we scale with governments, we have champions. We have champions in the governments. They are actually pushing it through. But as we know, bureaucrats change. So one of the things that we have learned from our experience is to institutionalize this. You need playbooks. You need the capacity within the system to know how to actually replicate this. So just make it more explicit, put all of these things, maybe the app, I heard the app is really helpful in even very senior HR professional learn. So how do you make that a little bit of an institutional knowledge and make that explicit and available and accessible so it sticks with the system? But yeah, I'll stop there.
Thank you, and I love the analogy of the road and the car. It sort of paints a really clear picture of these different components that you were talking about and how they all come together. Gunjan, sort of from your experience, is the same sort of experience that you have, or so if I can ask you, because you've been involved more in the nurse mentoring and other programs, which was like no mentoring questions for me, but you have experience. So from your work, in strengthening health systems across state, what has been the most effective system level approaches that sort of has ensured that quality improvements are continually checked and ensured in the delivery of care, and sort of can you link that up to the mentoring experience?
So again, thank you for that question, and I'll take off from where I left. Through the three initiatives, I tried to, I think, give a perspective of what has been done by setting up, again going back to those pillars, be it the process, the objective, the measurement criteria, the financing. So the healthcare delivery system, both government-led primarily, but also partner-supported, has enabled these things to come together. So again, different parts of a car or different cars traveling together towards a common destination. But what I would really like to go back to is the point which was made in the first panel today on the humanity aspect of mentoring. And for me, I think if the healthcare delivery system, there are multiple challenges which are still there, but if it has been able to succeed in addressing some of the challenges through mentorship, then it is primarily driven because of the cohort of mentors that have been created. And I'll go back to some words, I think, which have been used multiple times during the course of the discussions. And for me, the three words that stand out are intent, empathy, and trust. So I think these are the values that someone who signs up as a mentor, be it in a formal training program, which we have seen in healthcare delivery systems, or even, let's say, in one-to-one mentoring which is not structured, which was again being discussed. This is something which a mentor needs to imbibe. And going back to your earlier question on para-professionals, and we have seen that, heard multiple stories and examples today. I think with the right intent, a sense of empathy, a mentor who's not, let's say, who is a volunteer can still produce fantastic results. And equally, if not more important, is the trust. I think that's again being, so what I see is a commonality of what the different speakers have been mentioning, and that for me is the highlight of the day, that all of us more or less are at the same sort of page. So the trust, the bond that develops, again Meera alluded to it, that we have seen in multiple peer-led mentorship initiatives in health. I think for the designer of the mentorship initiative, it is important that the mentor cohort, as I said, internalizes all these aspects, because the start of the mentorship initiative is dependent more, and the engagement needs to come more from the mentors as compared to the mentee. And I might be wrong in my observation, my experience is pretty limited, but this is what I feel. And if I can be very, very candid, I think not everyone can be a good mentor or a true mentor, but it's not necessary for a mentor to be from the same professional background now, or be even a paid mentor. And I'll just end by, I think, sharing some thoughts here on what is that then becomes the most important sort of fulcrum. And let's be very frank, when you try to set up in health, mentorship is incentivized, both financial, non-financial. So when we are trying to set up, even in health, there are examples, a quality, primed, effective program which is based on, let's say, a volunteer mentorship model, that is very, very difficult. And I really appreciate the efforts the Mentor Together team and different stakeholders who are working in the youth mentorship program have. I wasn't aware of these, so it's been a real eye-opener. But on the flip side, it's what makes it more intensive, more engaging, and more process-oriented. So I think clarity, going back to the point of clarity on what the objectives are, clarity around the expectations from both the mentor and the mentee who are engaged, and the most important point, clarity around reflection and review. That, I think, gives an enabling environment for the mentor-mentee cohort to thrive. Some of these things we have been able to, I think, solve in the healthcare space. A lot remains, and I think multiple lessons for us taking back here from the forum.
Thank you so much, Gunjan, for that. And it's wonderful that you start with asking a question and you see these repeated answers, and you sort of coming to a conclusion from these different panelists. It's wonderful to hear that from different domains we sort of have starting to have an understanding of what this quality or designing for quality means. Meera, if I can get back to you, we've been hearing from the experiences in the Indian context, right? Can you share insights from the global context, particularly maybe from the US context, where they've sort of set up systems and institutionalized the mentoring system to sort of promote quality, right? So what have been the most important system-wide or institutional approaches, most effective ones? And to bring it back, to technology, right? What role does technology play in all of this?
Sure. Thank you so much, Vijayatri. Whatever, and again, yeah, as you said, it's very enlightening to see that from different domains, there are so much commonality of thoughts and structures with respect to mentoring. So even though we are talking about different outcomes, there is a lot of alignment in how we are approaching it, and that's actually very interesting for us all to observe. So what I spoke about, I think earlier, these thoughts have actually they're distilled because of the body of work that has actually taken place in the field of mentoring, especially in US. So there is a lot of research that has been happening in the domain of mentoring. And for example, we spoke about the processes, we spoke about the importance of an outcome-driven mentoring. These are what Mentor Together has actually adopted, and we were able to come to this conclusion. We were actually able to create this program because of the body of research that has happened there, and of course the implementation, the result of which we are able to see the mistakes and the great improvements and adopt them. So I would like to take your question a little away, Vijayatri, and probably talk about wish list that we would like to have in here, because here we have an audience. All of you are here because of your shared interest in mentoring, and we are all at different, I would say, alignments at different levels in where we want to reach. So just like, globally, this kind of a system is available. For example, there are systems for certifications of mentors. We talked about, again, volunteers. We talked about incentives. Gunjan was talking about incentives. And we also talked about not everyone can be a good mentor, but who is to decide that? Right? Can we have a system of simple certification which organizations can access easily? So not just the organizations, they have their advantage. They see that, they can actually weed out people who probably are not interested or committed. And at the same time, the mentors themselves, they have a great opportunity to build their confidence. They know that these are the things we have used. And as the earlier panel was talking about, it's not just for the mentoring. And I think I heard someone say it's not just that, we have seen that when that change happens, when they employ these techniques, they are most likely to employ it elsewhere, right? So a system of certification, and closely following that, I would say accreditation of what the mentoring organization does, which is there again globally. So process of studying the process, what happens, what is going right, and accreditation of the system. And then I would say again, I would definitely wish that we had a body of research here in India, which is more suited to our outcomes, our situations, which publishes papers. We're able to take it forward and apply it to our context. And there is other thing that globally which is present and we definitely would use. I think the speakers Vijay and Gunjan also spoke about it. Is actually a body of work. Right? For example, let's say like in the healthcare sector, there are more clearer systems on what needs to be done. But for mentoring, what is the training that needs to be done? What are the processes? And technology. What is the technology that we can use most easily to multiply X results? For example, we do have a platform which is actually helping us to reach out and also ensure that we are getting valid and credible data which we are able to collect, and it's easing the process of connecting the mentors and mentees. Now, why not this kind of a platform is available out there for a public good where anyone can access it, just like we have teacher training platforms which any organization, irrespective of where they are, can access it. So again, these are some of the things I would say are definitely there globally, and it would be great if we are able to get this into our system. And of course, I think one concern I would like to address, which I'm sure is many of us we often think about, is that of safety, right? So here we are connecting people at a slightly more personal level than a teacher-student relationship. And we are saying that we want a mentor to take that one additional step and deal with empathy and build a good relationship. So there are definitely safety concerns. So a system which will help us probably to, where anyone who volunteers has to commit. There is a process of, thorough search, which any organization which wants to get into mentoring can just adopt without having to build a framework to that level. So I would say these are some aspects of, again, globally which are available, including technology, research, body of work, which definitely we have a wish list that we could have in India too.
Thank you so much for that, Meera. So what I'm hearing is there are a lot of examples and experiences that we can draw from internationally, from the global context, but then we also need to be clear on why we are doing what, have buy-in from all the stakeholders and also have outcome and research to back up all that we're trying to do and establish some processes, right? So we can now open it up for questions. Please state your name. If you have the questions directed for someone, please let us know. And please try and keep it crisp so that we can ask many more people for their inputs.
Yeah, so my question is for Gunjan, and this is more also so that the other people on panel and in the group can take some insights, because the work majorly has been done with government and institutions. So a lot of conversation was done around who is to invest in the research, who is to invest in infrastructure, etc., etc. And a lot of the conversations have been facilitated either by philanthropy, corporates, but what was done in health has been with, say, medical institutions or with the government. And I wanted to understand if there are examples of how you have seen they have invested in quality, ensuring quality. They have like either put in money for research or put in money to create the platform. And if there is some intersectionality that the other, whether it be in the youth mentoring space or teacher mentoring space, etc., that people can take on with their respective institutions, which kind of drive them, whether it be in the education space or in the employment space.
Thank you, Gudia. We have been ex-colleagues, so I was expecting a question from her. I think when we talk, and I'll keep it very short, when we talk about scale, and if we talk about, let's say, doing something in a mission mode, the leverage that engaging governments can provide is unmatched, and it's the most, let's say, the most important ingredient of the cake that we are trying to bake. And I'll go back to the nurse mentoring program example. UP, as you all know, if it would have been a country, it would have been the 6th largest country in the world. A state with a population of almost 239 million people. I think now it's crossed 24 crores or whatever. 75 districts, 840 blocks, and each district with an average population of 20 to 30 lakhs. So this nurse mentoring program, when it was started through, again, engagement of the government of Uttar Pradesh at the very start, not as a parallel initiative, but started small. Because even the government, the foundation, or the partners through which the foundation was working never knew, despite a body of evidence around mentorship in health, as to what outcomes would it generate in a state like Uttar Pradesh, which has had its own set of challenges, though multiple of them have been addressed to a large extent. So we started in 100 blocks, where the foundation put in this external nurse mentor, which was a qualified practitioner of nursing who was brought in, let's say, from the external ecosystem, placed in these facilities or made to visit these facilities in regular intervals. And then when the results were appreciable, the model was scaled up across the entire state, but with the government of Uttar Pradesh nominating its own people as nurse mentors. A lot of the foundation staff, if not all, were also absorbed. And the government of Uttar Pradesh also, in partnership with Government of India, incentivizing this program. So the person at the facility level who was then the leader, ultimately the ownership needs to shift to the cohort of people who are engaged in the day-to-day work. And then I think mentorship also becomes easier. So there was an additional financial incentive which was built in to facilitate this process. And similarly, there have been other examples. So I think engaging at scale, at system level, it's imperative that we are able to leverage the strengths of all the different stakeholders, government being primary, but so do other partners of the ecosystem, so that again, going back to Vicky's example, they come together and form that car.
Thank you so much. And can we have the mic here?
Yeah.
Oh, sorry. Yes, please go ahead.
Hi, I'm Preeti. So as an organization, we are constantly learning about the mentoring space and designing our program in partnerships. So I think one of the things which constantly come to us, and even from our past experience, on kind of a failure on the quality, or and that's what I say, and learning and involving the youth, young leaders, young adults in designing the program. So how does quality get affected, or where do you see the mentees' onus and accountability towards the quality? I think one is that, and second, how does technology can play a better role, because now we know, like considering AI and all, so where does that come, and also to ensure the safety aspect?
Anyone? Meera?
Thank you, Preeti. So, yeah. So many times, right, in a mentoring relationship, there is, however well intentioned, the mentor is there is a perceived balance of difference in the balance of power that is considered, right? So when we are talking about the onus on the mentee, I think the program should be able to first create a space where the mentee and the mentor are meeting on an equal ground. And if the mentee has to literally stand up and grab what is offered to them, while on one hand we have to create a system where they are able to see the benefits of it, right? And secondly, we also need to be able to create, I think, into the program itself, a reason or a way for the mentee to build up their intent, or to build up their emotional skills, to build up why they need to actually build out the reason for them why this is powerful. So while I would say that the onus is on the mentee, I will say the onus is as much on the program as on the mentee. Of course, there are boundaries definitely for any program, and especially, research has shown that in a mentoring program, it's very important, and I think someone talked about it earlier. So there are boundaries for any mentoring program, and it is very important to also stop at the boundaries and look at, from a programmatic design aspect itself, what is the boundary in which you are ready to operate. So in terms of everything from the mentees, from the issues that the mentees are facing to what they want to reach. The second question was?
About the technology, use of technology in mentoring as it operates.
Yeah, so definitely technology is a great change maker today everywhere, right? So as in mentoring, like I was talking about using a platform. While these kind of systems are very commonly used, I would say in many other domains like education, healthcare, to connect different people. So technology can be a great connector in this case. And secondly, I will also say the training aspect of it, right? So there is, we talked about the importance of training. So technology can be a great way to make this available, more easily accessible, and also accountable. So these are some things I think definitely, and of course for measurement and evaluation of the process itself. Just as in, I think, if you take mentoring as a process, any other process, the way technology helps, mentoring can draw a lot of help from technology in the same way.
Thank you, Meera. Gunjan, did you have to add?
Very quickly, I think, on the technology bit, on a lighter note, I think technology is an enabler in a sense that over the next few years or decades, it will enable us have more time for things like mentorship. When a lot of tasks get automated, I think to survive in that ecosystem, that human-to-human connect will become all the more important. and possibly that is where I think mentorship as a field in itself will have an organic evolution with its own set of challenges when you move from a structured approach to, again, the example of the US. So I think multiple levers that can be optimized as to how we use technology. There have been multiple initiatives on the health part of it. But again, it's the appropriate use of technology, the more with the right intent, and not using technology because, or what we often end up doing, we have a solution and then we try to find the problem.
Thank you for those excellent questions. You know, I love how they are enabling us to continue the dialogue around quality from different angles and aspects. We'll take one last question.
I'm Abhishek. So I'll speak without mic. My question is for Vijay. You talked about the mechanism of reaching the outcome, and that's very important for the mentor-mentee relationship. And so Dr. Gunjan also said, like in health, the mechanisms part is slightly more clear than in the other domains which we work for. So now, I primarily work in jobs, like helping young people to get jobs. And mechanism for getting a job in this ecosystem, the current market is very fluctuating. Skills are getting redundant. How do we then create a mentor-mentee relationship directed towards outcome, which Meera talked about in this volatile, ever-evolving landscape? And who owns the outcome then? Is the mentor who's accountable for the outcome? Is the mentee who's accountable for the outcome, or the program designer?
I already said that I don't know anything as much as they both in terms of mentoring. When I meant the mechanism is, I was being generic in terms of what does quality mean. So in any program, it's about the mechanism that makes it possible to get, like what Meera said about the purpose, the design, right? Having a very clear purpose or the outcome. I would just, basically, my point about the mechanism was first diagnose the problem, and when you're actually trying to address it, then making sure that the mechanism addresses that problem and everybody's clear about that. What I said again about when you scale, about the core causal, the causal core. So I wouldn't, that's not my expertise, but an expert who is on the job market plus mentoring would be able to give you what essentially has to be the design, to be able to then make sure that the mechanism is put in place to the standard that needs to be maintained for it to be, for it to be of quality. The question was, what determines quality? So the quality is determined by having a clear problem definition and a mechanism for that. That's where I was coming from. Sorry, I can't answer the specific question.
I'm sorry for putting you on spot, but your reflections are all equally like that.
No, that's fine. That's totally.
I'd say that our closing panel, which is on mentoring for employability and employment, will get to this question of the mechanisms of mentoring that work for outcomes of employability and employment. And I'm pre-warning Livia that she will have to answer those questions.
Thank you so much, everyone. Thank you to all of you. I think it was a very enriching discussion, at least that's what I felt. And thank you to all of you. I know we don't have clear-cut answers as to what that ecosystem should be like, but I think that we've gotten started on the wish list, as Meera said, and how we can start thinking about some of those things, right? Thank you so much, everyone.
A heartfelt thank you to our panelists for sharing their expertise and helping us reimagine what high-quality mentoring can look like in India. And we also want to share that we really love how engaged all of you have been in the audience. So a big hand to all of you. So I now request Meera to hand over a small token of our appreciation and gratitude to all the panelists. A big round of applause, please.